If you're suffering with sciatica type symptoms, chances are that you've looked around the internet and found a bunch of advice that probably didn't work for you. There's a lot of very common advice out there for sciatica that is actually the wrong thing to be doing. So in today's video, we're going to be discussing the things that you need to avoid doing if you have sciatica. You want this problem to heal in the long term, and there's certain things that you need to avoid in the short term in order to get there. So that's what we're going to be talking about. Particularly if you've recently been diagnosed with sciatica or recently started having sciatica symptoms. Now, to be fair, some of the things that you do for sciatica in the beginning are different than the things that you do in the long term. And today we're going to be focusing more on if you just recently started having sciatica symptoms. Although some of these tips will work if you just started having it or you've been having it for a while. But first off, what is true sciatica pain? So the sciatic nerve starts from 4 nerve roots from L4 to S2, which are in your low back and upper hip. They join together to form the sciatic nerve, which goes down through your deep hip muscles, down the back of your thigh, and at your knee, it actually splits into 2 different branches and goes down the back of your calf and the side of your calf, which means your pain will travel along this path. So low back, deep hip, back of the thigh, side of the calf, or back of the calf, maybe even both. If you're suffering with pain that is in the front of your thigh or the side of your thigh, then probably what you're suffering from is not actually true sciatica, which means you want to be careful, because if you do something to treat sciatica, you may actually be causing increased damage to the tissue that is irritating you. All right, now if your pain follows that pattern and you believe that you truly have sciatica, here's the things that I need you to avoid. Number 1, I need you to avoid heat. So many patients I see want to put heat either on their low back or on their hip. Now what happens is that heat increases blood flow, and in general that sounds like a good idea because you want to increase the blood flow to increase the healing. However, increased blood flow leads to increased inflammation, which leads to increased pain in the sciatic nerve, because the sciatic nerve can get irritated by that inflammation. It gets bathed in it and it gets irritated, and that's what sends a signal up to the brain. So you want to avoid heat, and instead you want to use ice. Ice helps to decrease the inflammation and calm the system down, as well as the fact it's a pain inhibitor, which means it decreases your pain overall. Now you may feel like, well, I don't really like using ice, and I do understand that. You only need to do it for 3 to 5 minutes. That's what the research indicates is really helpful for that pain inhibition, which is what you're going for. The number 2 thing that I don't want you to do if you have sciatica is rest for too long. Now, this is a little bit of a complicated issue because people say, well, my doctor told me to rest, or I need to rest, or every time I move, it hurts. Now, there is a period of time when sciatica initially starts, especially if it started sudden, fast, and sharp, that you may need to rest. It's usually about 1 to 3 days, although for you, it may be more, where you need to just lay low, ice, find some small motions that can be helpful for you, and allow the tissues to heal enough that you're able to move without a compensation pattern. Most commonly, this is when the sciatic nerve is due to a disc herniation or rupture. And what happens is when the disc herniates or ruptures, it causes a lack of stability in the low back, which causes irritation of the sciatic nerve. But if you try to move too much, or try to walk it out, or try to exercise it out, and you're not moving correctly because there's damage to that disc, it is only going to make your problem worse. And how long does that take? It varies from person to person. The goal really is to rest as long as you need to in order to be able to walk normally, do some small exercises normally. Anytime you're doing anything with a compensation pattern, that is not the goal. And for some people, that's a day, some 3 days, some a week. It's really hard to put a specific number on it because everybody's different. The goal is really to make sure that when you're moving with the correct pattern so that you're not causing further trauma. Now, the other side of that coin is that you don't want to rest for too long. It used to be that when somebody got a sciatica diagnosis, they were sent to bed for 2 weeks and weren't allowed to move. And what happened is after that 2 weeks, they felt so much worse because every tissue in your body is designed to heal itself as long as it's moving correctly, which means it needs that movement in order to be able to heal. Now, it needs that normal movement, so you may need to rest for a short period of time. In general, resting for 2 weeks is too long and starts to cause other problems in your back and hips. So we want to rest for as long as is needed to allow for that normal motion, but we don't want to rest any longer than that. Try getting up regularly throughout the day, every hour or two, walk around the house, try some gentle exercises, and see if you can move correctly and move for as long as you can move correctly. It may only be a minute or two the first time, but maybe you can work yourself up to 5 to 10 minutes. Don't push farther than what your body is comfortable with, and make sure you rest whenever your body asks for it. The number 3 thing that I need you to do that I see being done all over the internet is stretching the sciatic nerve. Friends, I am here to tell you the sciatic nerve does not like to be stretched. So if you are doing a hamstring stretch on the side of your sciatica, you are stretching the sciatic nerve. And I understand that it often feels good initially because it puts some pressure on that nerve and it seems to decrease some of the tension. But what happens is that it actually increases inflammation. And you probably notice that more in the evening when you're more sedentary or when you lie down in bed. Now, it seems like if my hamstrings are tight and stretching my hamstrings is going to make things better. And I understand that train of thought because stretching decreases hamstring tension. However, you're also stretching that sciatic nerve. So it's not going to go well in those initial phases of sciatica. Now, this may be a case where once the sciatic symptoms have calmed down a little bit, you may actually need to do some hamstring stretching later on in the phases. But initially, you've got a hot sciatic nerve that just went a couple days ago or a day ago. Do not be stretching that sciatic nerve. Now, if you really feel like you need to stretch, what I want you to do is stretch the opposite side. Because if you stretch the opposite side, it helps to pull some pressure away from that sciatic nerve that's really inflamed. Number 4 is one that I've seen on the internet a lot, and that is doing a self-traction for your low back. Friends, please do not do any self-traction for your low back when you have a hot sciatic nerve. Now, this can be done with something like an inversion table. It can also be done if you're laying off the edge of your bed or over the edge of your couch. In the initial stages of a hot sciatic nerve that just went within the past couple of days, this may feel good when you do it, but it is going to increase your symptoms in the long term because it's going to increase the inflammation. Your body does not have the stability to be able to do this type of motion right now. Now, again, if you have chronic sciatica that's kind of more of a dull roar, something like a self-traction may actually be helpful for you as you're able to open up that space. But it's really important to differentiate. I would never recommend that for someone who had a sciatic nerve that just blew really quickly. Whereas if I had someone who had sciatic symptoms that had been going on for a long period of time, that may be the thing that helps them to resolve in the long term. And please, whatever you do, if you know that you have an instability in your disc, do not use an inversion table. The inversion table will actually help to open up that joint, but it'll decrease stability in the disc, which means it'll feel great when you're inverted, and it won't feel so good when you get gravity back on your head. The number 5 thing that I need you to avoid if you have recent onset of sciatica symptoms is doing any back exercises or stretches. Friends, if you are stretching your low back and you have sciatica symptoms, this is stretching everything out, which puts more pressure on the sciatic nerve. And a lot of people think, oh, I feel better when I do it, but afterwards they don't feel good at all. Again, sciatic nerve does not like being stretched. Actually, any nerve in our body does not like being stretched. And it may feel better when the muscles and the joints and the ligaments get stretched. But if they get stretched too much, they lose stability and control, which can put increased pressure on the sciatic nerve. The opposite of that is doing any exercises, like any back extension type exercises where you're bending backwards. Again, something that I see very commonly on the internet. If you're doing back extension exercises, you're activating those muscles, those big ropey muscles that go along your lumbar spine. And when you activate them, they compress. They put pressure on these joints and the discs. So if you have a disc that just got herniated or ruptured and you have muscles that put more pressure on it, well, what's going to happen? Nothing good is going to happen from that. So I want you to avoid exercising those low back muscles in the initial phases of sciatica. Now again, if you have a chronic sciatica and you're trying to get that niggling pain to go away, it may be indicated for you, but you really need to be talking to a specialist at that point to know at what point is it okay for you to be doing back exercises. Because I do get it that when you have sciatica, obviously your back muscles are not activating the way they should. I understand why you want to exercise, and it does make perfect sense. It's just not the best thing to be doing right now. Now, you can be exercising even if you have sciatica. You just have to make sure you're doing the right exercises. So I'm going to link a playlist here that has a bunch of things that you can be doing that are safe to do with sciatica, including a video on the best sleeping positions for sciatica. And my bonus tip, the last thing that I don't want you to do if you have sciatica type symptoms is rush off to get surgery. Many people feel like the only way I'm going to solve this problem is to have surgery, that's the only thing that will relieve my sciatic nerve symptoms. The thing is, it doesn't get to the root cause. It may actually help your symptoms and it may actually decrease your pain. It may actually eliminate your sciatica symptoms for now, but surgery does not deal with the root issue that caused this problem in the first place. Even if it's a disc, let's say you have a disc rupture or herniation. And so the surgeon says, oh, well, we'll go in and we'll clean all that up and then you won't have any sciatica symptoms ever again. You might not have sciatica symptoms right after surgery, which that's fantastic. But why did that disc herniate or rupture in the first place? I've seen too many people that once they get lumbar spine surgery, they end up going in every couple of years for another one. This does not set you up for long-term success because you never deal with the root issue that caused this problem in the first place. And I also want to tell you, while I was getting my PhD, I would do surgical observations. And one time I observed a lumbar discectomy. So there was a lumbar disc that was ruptured. So the discal material was outside of the disc. The surgeon was going to go in there and remove that discal material to get rid of the sciatica symptoms. When the doctor got in there, and he was in the right location, he was a very good doctor and he was very careful with where he went, the discal material was no longer there outside of the disc. The body had actually reabsorbed that discal material in the 3 weeks since the MRI had been done. Let me tell you, the surgeon was none too happy when he got in there and found out that the discal material was no longer there. Truly, the surgery was not indicated, and even the surgeon really knew that. Of course, he didn't say that, but he knew that in that moment. So now there's a patient who didn't need the surgery that now has to deal with scar tissue formation and potential muscles not activating correctly and needing to heal from surgery, in addition to the fact of needing to deal with the root cause of what caused this problem in the first place. I will tell you that patients who come into my clinic who have had lumbar surgery can still get results by dealing with the root cause, but once you have a surgery, it makes it way more difficult. All right, so there you have it, my top tips of what not to do with sciatica, especially if it just got flared up recently. Now, I would love to hear your comments on this because I understand that this is an extremely controversial video. It is going against most of what is on the internet today and what most people are putting up there as videos. However, all of this information is scientifically backed, well researched, and based on over 20 years of physical therapy experience. So I'd love to hear your comments. Were there any questions or anything that you wanted me to dig deeper in? I'd love to make a video just for you.